Hi, welcome everyone to Community Connections, brought to you by Arizona Care Hospice. Today, I'm excited. We are joined by two lovely ladies from Visiting Angels here in the local area, and I'd like to introduce you to them. Today, we have Monica and Melissa with us. Monica, if you want to maybe start, let our listeners know a little bit about you, and We'll move on to Melissa after.
I'm Monica Bananto with Visiting Angels. I happen to be one of the directors of operations as well as one of the care managers in our Mesa office. And I've been in the industry now, in the senior industry, about 11 years.
Awesome. 11 years. That's a long time.
Yes.
Long time for healthcare. How about you, Melissa?
My name's Melissa McCracken. I am one of the care managers also at Visiting Angels, and I was brought in about 4 years ago with the Mesa office as well.
Okay. So now you're saying the Mesa office, and Visiting Angels has been around for quite a bit.
Yeah,
correct?
actually 21 years.
Okay.
And they started franchised out in Philadelphia or Pennsylvania, I believe. Yeah.
Yeah.
And then, and so now we actually are nationwide and globally now. So we're out in Korea and Canada and the UK.
That's awesome.
Yeah.
That is awesome. So what brought you and you may each have your own story, and we'll get to know you a little bit, and then we're going to move on. I have some lovely questions for us today. But what brought each of you to Visiting Angels? I'm always curious as to how people get to where they are.
Great question. I was in non-medical prior, and then I switched over to home health, and there was a great opportunity that came up through Visiting Angels in the office that I happened to be at with Bob Daly. They had a really great reputation. And at that time, our home health agency was closing. They brought us in to do the private sector. Okay. And so, unfortunately, they were closing their doors. So Bob approached me, as well as Elaine Pokeryant, who happens to be our PR person and dementia person, right? And they had such a great reputation that I definitely wanted to be part of their team.
That's awesome.
Yeah, so it worked out great.
That's awesome. How about you, Melissa?
Well, my story's a little different. I was getting a degree in healthcare management, and my husband was in the Marine Corps for 25 years, and he was getting ready to retire. And we're both from the East Coast. He's from Boston. I'm originally from Pennsylvania, and we both hate cold weather. So we decided we weren't going back there and started to put some feelers out. And Monica and I knew each other prior to Visiting Angels, and the opportunity arose, and I was fortunate enough to get an interview, and I was able to join the team over in the Mesa office, and it's just been a blessing.
Well, and just partnering with both of you, I can see how well you both work together, and you have fun. You get it. Mm-hmm. And I see the great team that you guys present for the community.
Thank you.
So can you tell us, just to kind of help our listeners understand a little bit more about Visiting Angels? In general, what is Visiting Angels?
Yeah, I'll take it. So Visiting Angels, we like to tell people that we work kind of like personal assistants. We help adults and adults only. Obviously, here in Arizona, we have a large senior community, so a lot of times we're working with seniors. But we come in and do the non-medical side of home care. So we can do light housekeeping. We can help with personal care, showers, bathing, shaving, grooming, meal prep, changing the sheets on the bed, doing cleaning out the fridge, taking them to appointments. The nice thing about us is the HIPAA paperwork allows us to go in with our clients and take notes, report back to any family members that may not live in the area. But on top of all that, we get to work with people such as yourselves within the community, with hospices and different entities that also have kind of the same goal, and that's just to keep the seniors at home and keep them safe and keep them happy.
Awesome.
And that's what we do.
Awesome. You had mentioned HIPAA.
Yes.
And so I'm sure that's a term that our listeners are very well familiar with too. Whenever you go to your medical appointments, you're signing the HIPAA paperwork and all that. So there is buzz over the years as far as different regulatory standards for home care. Mm-hmm. Are there regulatory standards? Let's go there and just kind of start.
That's a great question. Every state is different. And Arizona happens to be one of those different states. Unfortunately, in our state, there are no regulations on who can open a home care agency like ours. With that said, our owner, Bob, got together with a couple other home care owners and started the Arizona In-Home Care Association about 17 years ago, which is an abbreviation. We call it ASNAHA. Okay. And so with that said, they're helping to try to bring regulations into our state. Sure. But in the meantime, that kind of holds standards. And that's what those companies underneath that ASNAHA umbrella follow. For example, all our caregivers are our employees. There's no independent contractors. We are licensed and bonded. We do an FBI background check in all 50 states. We make sure they're CPR, first aid certified. They're TB tested, drug tested. Some of them do random drug testing as well. And those that provide transportation, we make sure they do a background check and they have a clean driving record.
Okay.
Now, with that being said, just so we understand, in our state, ASNAHA is not mandated. So not all companies belong to ASNAHA, not all non-medical home care. So when we have people that call us, clients that call us, and they need help, if for whatever reason, we always like to give choice to those people that call, and we direct them to the ASNAHA website. It's a great website full of resources. It allows you to put in the zip code and see who services your area. And then you can make those phone calls to those different agencies and see who does what a little bit differently to see who's the best fit for your family or your loved one. I
love that you brought up the word choice because in the world of healthcare, specifically senior healthcare, I don't know about you folks, but I know I've been in the field 27 years and, getting around that choice option it can be challenging because when people don't understand their rights and how to advocate for themselves in different medical situations, they're not aware that they do have that choice. That's whether correct. It's for home care, whether it's for hospice, whether it's for home health. And so, how do you have those conversations with the clients that you come in contact with as far as choosing and knowing how to choose what's best for them or who's best for them? How do you approach that?
Well, and it's funny because you can tell Monica and I, we work well together, but we're very different as well. So our approaches tend to be a little different. So sometimes we may get on the phone with someone or we may get an assessment and we may talk it through, and maybe Monica's a better fit to go visit that family for whatever reason. And we make sure that we take all of that into account when helping our families. Okay. But we try to do more than just ask basic questions. We do a little digging. We kind of see who's in the home, who's providing services. Maybe if they were military, sometimes there's military benefits. If there's long-term care policies, we kind of ask all these questions in the initial phone conversation to see where we can go. We know how worthy it is, especially with you guys and the services you provide. So sometimes we'll try to qualify and see if they may be somebody that we could call you and partner with you and see if you guys could give them some support as well.
Okay. And I think that's something that we do very well. Sometimes we also tell, on the phone conversations when we get those inquiries, if you will, that if we're not the right fit, we're going to help you find the right fit.
Absolutely.
And sometimes it comes down to cost, minimum hours, right. If they have a long-term care policy, things of that nature. A lot of
different factors.
Yeah, so a lot of factors come into play. So sometimes I would say they don't even have a starting point. So yes, we kind of help guide them through that starting point.
Okay, and that was kind of leading actually a good transition to my next question. And I know you mentioned different ways of paying or insurance or minimum hours, things like that. And I'm going to come back to that because I'm sure some of our listeners are probably wondering about that, but that is something we will discuss. But when you get a phone call, my first question, how are people finding you currently? Where are people calling you, and what are their needs at this point when you get that initial phone call?
A lot of the time we get calls because people watch TV. We advertise on TV. We have TV commercials. So Hallmark Channel is really popular, and now that the season's gearing up for those Hallmark specials, a lot of people will start calling us there. But
and PR,
word of mouth is huge for us. As Monica mentioned, we have Elaine Poker-Yant that does a lot of our PR. She's she's tapped into the community. And so we get a lot of word of mouth referrals. Mm-hmm. So I would say that
speaks volumes.
Yeah,
for you guys.
It does.
And also a lot of our partnerships, a lot of actual doctors' offices and hospitals where they've actually seen our caregivers, providing care, impressed with what they've seen. We've gotten that too. So
absolutely.
We've been very fortunate.
Okay.
In a lot of different ways.
So when people are reaching
internet.
out to you, what are some of the common needs that are being presented at that time? What are some of those general needs? Is there a typical client, or,
That's a great question. I would say it just comes from all different angles. You have, I would say, family members that haven't seen their parents in a while. So like over the holidays, we'll get a lot of visits, and then it'll be like, wow, I didn't know mom was that bad. Right. Or, she plays it off well over the phone, so the holidays really kind of open their eyes a little bit to find out their needs are there.
I think sometimes it ebbs and flows too, because it seems like maybe one week we get a lot of people that may be afflicted with Parkinson's, and then the next week we'll get people that are coming out of rehab, and then if Elaine happens to do a presentation, maybe we'll get a lot of people from a certain area where she was at. So it just kind of depends on what's going on. A lot of times when people seem to have maybe the appointments with their doctors and they have follow-ups and whatnot, like Monica said, we get a lot of doctor referrals. So they will give them our name and number. They know that we will take them to appointments. We can sit with them and do that piece that seems to be missing.
Okay. The one thing that I do notice from our senior industry, our senior clientele, if you will, is they're worried about getting older. And if they need the help, that scares them because that means I'm getting old.
Right.
So we really come with the approach of come in as a personal assistant. We're not here to take over. Our main goal is to keep them independent as much as possible, to keep you safe, and that you have a great quality of life. Mm-hmm. That's pretty much our goal.
And I love that, especially because we partner as much as we do in general between hospice and home care. Mm-hmm. I'm always asked from a hospice standpoint, well, I shouldn't say I'm always asked, but there's always that assumption that hospice teams are there quite often, almost around the clock.
Right.
And that's where we need to do our education on our side, but then that's where we partner a lot with home cares to fill in those gaps. And so from a services standpoint, when you do have a client, you had mentioned a little bit earlier as far as minimum hours or minimum time. Can you talk a little bit about that and how that looks if somebody is considering maybe having somebody come into the home for help?
Sure. Well, since there are no regulations, all home care agencies can do what they wish.
Make their own rules.
And that's why we tell them, please shop around, ask a lot of questions. And so, for example, with our office, even though we're franchised, we're also very different across the board.
Okay.
So in our office in particular, we have a 4-hour minimum. You can turn us on and off at your leisure. As for a deposit, all we ask is for a credit card on file, like a hotel.
Sure.
So there are other agencies that provide 1 hour.
I just want to expand just a second. So that 4-hour minimum means 4 hours in one particular visit. So if we come, we're going to be there from 8 to 12 or 10 to 2. Or you can choose the 4 hours, but we are there for 4 straight hours. Okay. That minimum, we don't have any weekly or monthly. So turning us on and off, if, let's say, you need a ride to a doctor's appointment because you're having cataract surgery, you can use us for that and then not use us again until you have the next eye done, or maybe you just decide you need a little help. So that is, I guess, the one question, because people always want to know if they can divide up those 4 hours.
Okay. So if they're calling you for an appointment, say for transportation, they're counting on a 4-hour time block for that
Correct.
episode. Okay.
Absolutely.
Okay.
That's when they can use us going to the eye doctor, coming home, let's make you a meal, we throw in a load of laundry. But once again, that personal
Pick
assistant.
up prescriptions, anything that you need us to do within those 4 hours, we will do.
But the thing that we have to keep in mind is we're non-medical.
Yeah, so let's talk about that. And from a non-medical standpoint, how does that look as far as, for our listeners, are there certain boundaries that would be easy for them to remember when it comes time to maybe thinking about home care? It's like, okay, I remember Monica and Melissa said that they could do this, but not this. So
Absolutely.
let's talk a little bit about
I'll
that.
let you take that.
Yeah, so the do's and don'ts, we don't do anything with medication. That's a big one. We get a lot of calls for that. We cannot fill a med set. We cannot dispense any medication, including Tylenol.
Can you remind people?
We can remind, and if it's set up in a med set, so this is where you guys come into play. If you guys come in and set up the med sets, we can open up Monday and take those pills and have them take Monday's pills because it's all dosed out.
Okay.
But we cannot open a Tylenol bottle, a prescription bottle. We cannot dose medication.
Okay.
So if you have a headache, it's kind of like, okay,
Yeah.
you need to take two, but I only could.
We can
Bring you
open
the
the bottle and maybe set it down and make sure that they pour 2 pills out and don't take any more than that. But we're not allowed to administer two pills to a client.
Okay.
We don't do any wound care. Now, if you're in the house and they get a cut on their thumb and they need you to help put a Band-Aid because they're...
Sure.
That we will do. But if you have any type of ongoing wound care, we cannot do that.
We don't clip nails. No
That
nail
would be
clipping.
dangerous.
Toenails, especially.
We can file.
Yes.
But we can't
So now
cut.
for our listeners who may not understand, why can you not help with that?
Well, a lot of our clients are diabetic. And when you clip toenails, you run the risk of infection, hangnails. It's a very big rabbit hole that you can go down. So we just don't do any of that.
Okay.
Now, just because we don't do it doesn't mean we don't have resources to get you people. There are mobile podiatrists that will come out and do your nails. We can help with that as well. So we're full of resources, and that's the one thing we kind of pride ourselves on is we've made sure to compile. We have kind of a Bible, if you will, at the office of anything mobile that you would need, and you can always call us. You don't have to use us for services to use us for our resources. We will help whoever. If they call the office, and a lot of times if we don't know, we'll hang up and we'll look at each other and be like, that's a new one. And then we go ahead and we add more pages. So we do a lot of that. And we're always, in the valley.
In searching.
We'll be out driving and we'll see somebody that says mobile and we'll be like, snap, snap. And then we come back to the office and we're like, look what I just saw. So
I love it.
We do a lot of that.
And then we also vet them. We're not going to just send anybody to your home.
No.
So, if we see like a handyman, or a mobile eye doctor, a mobile repair eye person that does eyeglasses, we invite them over, mention that we're interested in their services, kind of get to know a little bit about them to see, would this be someone that we would want to put our name behind?
Absolutely.
To be able to help us. So absolutely.
So let me, I just want to go back when we were talking about non-medical. So obviously medicine has the word med in it. So that's more, maybe well known that wouldn't be something you help with. But what about just hands-on care? How much can you do with the individual themselves? Can you help with if they need to help get dressed? Can you help in the bathroom areas?
Yes.
To what extent can you help in those?
All personal care we can do. We will have them shower, undress, dress, change a brief.
Okay.
They can, if someone has an accident, they will clean them up from that accident. We will help somebody shave if, a gentleman wants to shave his face.
Electric shaver.
Yes, an electric razor.
Mm-hmm. Okay.
We will wash hair. I have a client right now. Our caregivers go in and they'll set her hair every week that they're with her. They put it in rollers and they will do that for her. So anything that we can do to improve their quality of life and make sure that they feel better, that's what we will do. With the exception of, we don't do any type of injections. We don't do that.
Sure.
If they need help,
insulin.
if they're going to check their
blood
sugar and they can get it, we can do the poke. But anybody anybody on a sliding scale or anybody that has that type of, we don't do any of that.
Okay. Okay.
I know that goes back to medicine, but
Sure.
but as we can help them poke and we can help them check, but we can't administer any insulin after the fact.
We can, because we also get confused a lot with home health.
Yes.
So, so sometimes they've had home health in their home before versus home care.
Okay.
So sometimes that's confusing as well because they have a home health aide. But we can also help with taking their blood pressure as long as it's on a cuff, that's red, and then we can also put them on a scale and write things down for them.
Okay.
So we're able to do those type
We
of
will
things.
also empty catheter bags. We will not change a catheter or do anything like that, but the bag we can empty, clean it, and
Okay.
reattach.
We can help transfer. We can use
gonna
Hoyers,
ask about that.
wheelchairs, anybody
Sliding
that's
boards.
bedbound.
Okay.
Like I said, almost like a personal assistant
Right.
that you would need right by your side to help you have quality of life. We're there to help.
And then we had mentioned appointments earlier. So can you transport individuals?
Yes.
In our office, yes.
Okay. So some may not be
And
able
some
or
home
don't
health
do that.
agencies don't
Okay.
do transport.
Okay.
But we do.
And we can transport either the caregivers will take the client in their vehicle, or if the client has a vehicle that they wish the caregiver to drive, they can do that because we do vet all of our caregivers. We have their license, their insurance, and a copy of their driving record all on file.
Okay.
So they're pretty strict. If you have so much as a parking ticket, you're deemed inappropriate for transport. So
Okay.
you will get someone that is safe.
Okay.
Absolutely.
So when it comes to working with the family, if there is an individual where there's an outside responsible party and they're just concerned about mom or dad or grandpa, how does your office maintain communications with, say, the folks that are arranging the help coming into the home versus the person receiving the care themselves? How does that look as far as how do you stay connected with your families? Not specifically
Phone
the client.
calls, emails.
Emails, we text. We have texting capabilities through our office, which has been a godsend, especially this year. A lot of people prefer to text as opposed to getting those phone calls.
I've seen a lot more of that, yes.
We also like to keep notebooks in the home so that when the caregivers are there and they, let's say, John had a great day today, he had breakfast, wasn't wanting lunch, took a shower. Mm-hmm. When his daughter Susie comes, she can open up that notebook and kind of see day by day what's going on.
Perfect.
It also allows any other entities in the home, if there's outside neighbors or if hospice is in the home, to kind of look and see what's going on as well. Everybody has access to that notebook. It's not private. So that's a really good communication log we found for anybody that's got maybe living alone or has family members that come and go.
Or partnerships, like
absolutely.
home health,
Okay.
how are they getting around, have they been able to do things, their exercises on time.
Awesome.
And then also with hospice as well to, when was the last, have we had a BM, recently or stuff like that. So.
Okay. Awesome. I am looking at my cheat note because I want to make sure I ask everything. We're covering so much already. One thing I know that I'm asked a lot when I do talk about home care options for even our patients or the greater community is the cost. And a lot of folks get confused, I think, as far as what insurance will cover. Nowadays, I don't know if you guys hear much of it, but for a time there, I was hearing more about home health or long-term care insurance policies.
Yes.
And so how does that look for Visiting Angels for your office and the payment side of things? Because we have to talk about it.
We do. And unfortunately, Medicare does not cover non-medical home care inside the house. There's talk about it, and every year we hear a little more that Medicare Part C is going to cover it, and then you don't hear anything about it. So as of today, Medicare still does not cover our services.
Okay.
We do accept credit cards or, a lot of times we have family members that will pay for care for a loved one, and that we kind of decide at the time of the assessment that we do.
Okay.
Now, as far as long-term care policies, if you've heard about them, they're all written just a little bit differently. So
You want to read yours.
that's something that I think we do well. And we will sit with the family members and the client, and we will call the long-term care company and find out if they
With
have
them there.
exclusionary periods, if they have to pay out of pocket for a certain amount of time, what exactly they're going to cover.
Okay.
Most of them have a daily max. It gets confusing for some of our clients because a lot of times they'll say, well, that's an unlimited policy, which it is, but you can live to 250 years old and they'll cover you, but they're not going to do any more than this amount of money per day.
Okay.
So we have to kind of have that conversation
And
with them.
also, some of them require that you have a CNA or a certified caregiver. And once again, since we're not regulated in our state, it's not really required that any home care agencies have that level of caregiver. So, so that's something else. I mean, a lot of us do.
I was going to say we're very fortunate because we have a lot.
We have quite a few.
Well, I was going to say within the industry, not necessarily our office at this time, but we do have some on staff.
So that's something they have to be aware of.
Okay.
So that way they have it covered, you know, because if they can't have that, and sometimes we ask the additional questions that since we've been doing it for so long, to help educate them. So like, you know, does it cover equipment?
Because some policies do, but you don't know that until you ask that question.
Sure.
Right. And they're only wanting to share so much.
And then finding out about the exclusionary periods we found is important because a lot of times people will say, well, you know, I'm going to save this. I'm going to open it when I need it. And they may be 90 years old and that's great, but we like to kind of guide them a little bit because as you know, those policies are expensive.
They can be tricky.
Yeah, and they're expensive and they've paid a lot of money into them. So we just want to help everybody kind of understand what their options are. Again, just giving them choice to see what they can utilize and how it's going to be best for them.
Okay.
And we also try to get the families involved because sometimes there is a POA, you know, that lives in a different state, or family members. We Zoom, you know, to do assessments. We can FaceTime family members into the assessment that they can't be there at the time. We do everything the way we would hope someone would do it for us. You know?
Exactly.
Awesome. Love that.
So we really take it that next step. You know, to try to get everybody on the same page. Now, we also have run into families that have like 9 siblings. You know, everybody wants to have a say. So we know at that time we have to, we'll say, let's pick you guys together as a group, pick a representative, you know, to go ahead and be the main person of contact for your family. And that way it'll make it easier.
Sure.
Because otherwise it's kind of like, why isn't mom doing this? And we wanted this. And then, so it can get challenging at times.
It can.
Family dynamics. Absolutely.
Let me ask you this, and I think we covered a lot of what I've one other thing after this, but how has the pandemic affected you, your agency, your clients? Have you seen an impact on Visiting Angels from the pandemic? Have you seen either way, pros, cons? What has been your experience so far? I know from hospice we're heavily Medicare regulated, and so you know we've had to do a lot of different changes from a hospice standpoint. But curious with home care.
Well, with us being non-medical, it was kind of tricky at first because we didn't and still do not care for COVID patients. So because we don't have the PPE equipment to hand out to our people to keep everybody safe. So at first that was a little tricky, but now that things seem to have kind of leveled out, we have been extremely busy from the minute the pandemic hit because a lot of people started pulling their loved ones out of the facilities and the communities because once they went on lockdown, they didn't want to go through that again.
Sure.
So it was challenging at first trying to see how to best help these families and support the loved ones that they were bringing home. And, you know, it was difficult for us because there were times we had to have those difficult conversations and say, yeah, you had them in a facility for a reason and we just aren't able to support it at home. So that was, I think, probably the most challenging for us through the pandemic.
And I don't think they were, the other thing that, you know, obviously everybody was scared. So we also had our caregivers that are, we call them a sandwich family. They're taking care of their grandchildren and, you know, now their grandchildren weren't going to school or the parents were now not sure about what was going on with work. So now they were, you know, or their kids were like, I don't want you working, you know, in strangers' homes, either.
Right.
So it was going in both directions. So, so we had just a up and down situation with that as well. So we, some of our caregivers, took a leave of absence, if you will, short leave of absence. So that kind of affected the pool.
I think if anything, it taught us to kind of stop and breathe and look at each situation individually from all angles. It wasn't quite a cookie cutter situation anymore. We had to learn to be a little more fluid and a little more flexible with each client and each caregiver and each situation that was brought to us.
So if you have families that are listening and wondering, gosh, we really need to do something for our loved one, and they're having hesitancies about the whole pandemic situation and people coming into their home, that how can we give them peace of mind?
I always say the good thing about our turning us off and on is an opportunity to test us out. Let's see how it goes. Sometimes we'll get those, they'll be like, oh, we don't need that much help, just one day. Then the one day was like, well, that wasn't so bad. And those 4 hours went by so fast.
Yeah.
Can Susie come back,
right?
On Thursday? So that's how we've kind of got some clients, I would say, to kind of stay on a little longer because they found the benefit of it. And then knowing that they can turn us off. And then sometimes it was like, oh, I cataract surgery, or I broke my arm. We have a lot. We've been very blessed by having a lot of clients returning to us.
Absolutely.
Nice.
So it'll be like, oh, we had you 2 years ago. I didn't think I needed you guys then. We get a lot of those calls back, and I think we're ready now to talk again. So
they're comfortable.
And we also get a lot of referrals from old clients that, they'll say to us, oh, well, so-and-so used you and they suggested I call you. And so we're getting a lot that way as well. Yeah. And that's nice to hear.
And there are some people that just want to shower. Like, I don't need you for 4 hours. I just need to shower. And there are those agencies that provide 1 hour of care for those type of things. So
but like you had said earlier, there's so much other stuff that could be done while you're in the home. And that kind of leads to my last point is independence. You want to maintain the person's independence as much as you can. And they may be thinking, or the family members may be thinking, well, gosh, Mom, she really just needs help with showering. Well, let's talk a little bit, or, how is she eating? Is she eating good? For you to be able to have those conversations and explore things, kind of I always say, peel back the layers, of the onion. And I think families find that once somebody like Visiting Angels is in the home, they don't realize how much other things could be supported with.
Well, we were talking this morning because a lot of times we do assessments before we move in further. We go into the home, we sit down with the potential client and family if they're available. And that gives us an opportunity to kind of see where everybody's at. And we'll tell them we want to know what your vision is and what Dad's vision is and how we can kind of meet in the middle and make that happen. And that's a really important part, especially for us, because if we get in there and they're just no, then maybe 4 hours is too much for this particular client. And let's give you an hourly person. And then as we build that trust, so it kind of allows us to just see what the needs are and make sure that we're meeting their needs. Because yes, we are in business and yes, this is our job. But at the end of the day,
doing the right thing.
Yeah, if you do the right thing for people, that's what's most important. And that's what we try to do each and day.
I also think having the eyes on them, when they also leave a lot of things out, during the phone calls. So when we're there, oh, I see there's oxygen, in the home. We forgot to give us the diagnosis of, I have a, COPD. Okay. I see him struggling trying to get out of the chair. Right. Things like that. And that's when we kind of go, okay, why don't we go in this direction? Like home health is covered by your insurance at 100%, provides physical therapy, occupational therapy, a nurse, a home health aide. We have hospices that can provide palliative care, and hospice, if you qualify for hospice, also once again covered by your insurance. With us bringing those entities in first, then they kind of go, oh, they were looking after my best interest.
Well,
and that's the things that we're trying to get them to realize. It's like, we all work as a team to collaborate to be able to care for you properly.
Sure.
So,
and I can relate to what you're saying, because even from a hospice standpoint, is seeing the people in person is so much more valuable than just doing a phone conversation. The last thing, I think, just as human beings, the last thing we want to do is tell all that we can't do. We don't want to brag at what we can't do or not able to do. We only want people to hear what we're able to do. And so, I think it's just a natural thing. That's not who we are as human beings. So when we get into the homes and we see, okay, well, she's saying she only needs help with this, but gosh, when she's walking from point A to point B, she sure as heck isn't steady. And, you see all these other dynamics going on. So,
and sometimes the caregiver, who's taking care of the client, and we'll use dementia right now as an example, we have to make sure they're not getting burned out either.
Exactly.
And focusing on the caregiver as much as the client. Sometimes it's a package deal, that we're trying to go in, okay, you need to catch your breath as well. What's going to happen if you don't take care of yourself, because he can't do it for you.
Right.
So how does that look?
Right.
And unfortunately, sometimes we're having those difficult conversations.
And I do think, too, sometimes you do have those family members that tend to be the alarmists, that think their particular family member is doing much worse than what it is. And we'll get in and we'll see it and we'll say,
you can see the other side. Yep.
That's not the case. So at that point, we'll offer, maybe that hourly care, or we have different partners that we have in the community that we say, well, they could stop in just for that hour and do a check-in, and maybe you don't need care at this point.
And sometimes I don't even know what's out there.
Right.
So like adult daycare.
Exactly.
Education just a couple,
huge.
Would that work for you? And also finding them like support groups, for them as well.
So
like
you mentioned earlier, you're in the very beginning when we first started talking, you compared yourself to personal assistants. Definitely you need to squeeze an advocate somewhere in that, because you really are. You're truly doing that, not only for your clients, but for the family members.
Absolutely.
It's always, they don't know what they don't know.
Exactly.
And that's a standpoint I've always come from, is everybody needs to be educated.
Absolutely.
And you need to advocate for yourself as much as you can. If you don't know, find somebody who does know. It's huge.
And I will say, for Monica and I, we have quite a few clients between the two of us. So for us, we rely so heavily on our caregivers to communicate. And we're both very fortunate that we have what I would consider the cream of the crop as far as caregivers go with our office. And each and every lady and gentleman that works with us, they will call us, they will give us updates, they know how to advocate for their clients because they build that bond with them. And it just makes our job so much easier when they call us and say, hey, Melissa, I'm with so-and-so and he's not having a good day. And then I can get involved. But I wouldn't know that if we didn't have that caregiver in the home. So it as the advocacy goes, I think that it's not just a family member or just a care manager, but we need to get everybody in place that will advocate for that patient, especially when they can't advocate for themselves.
And sometimes the family members also have great relationships with our schedulers, so they'll share things with the schedulers. And that's one thing that we hang our hat on is, we're all working together for the same goal. So it's like, oh my gosh, this is so great. Right. Thank you, Mary, for calling me. Let me transfer you over to Melissa. I really feel that she needs to be aware of this, because now we're going to a neurologist appointment. It's like, when did that start? Yeah. Okay. So, so it's just kind of being in the know. So sometimes, like I said, they'll build those relationships with the schedulers because, if they're calling all the time. So then we have that
so I guess for our families, they don't just get us as advocates. They get the whole office. So everybody's going to be there helping them out. Yeah,
so it's really, like I said, like a whole office team environment.
Absolutely.
That's awesome.
Yeah.
Well, you guys are amazing. And I'm so happy we could finally connect, get you guys out to come and talk with the community. I think what Visiting Angels does is very important, very needed out in the community. For our listeners, if they're thinking, okay, this all sounds great, but how do I connect with these guys? So how do they reach you?
Well, we would tell since we're franchised and we're in different territories, we will lead you to the right office.
Absolutely.
So feel free to give us a call at our office.
Okay.
Our phone number is 480-833-8247. You can ask for either Melissa or myself, or ask, Peggy, who's our receptionist, hey, I live in, Fountain Hills.
Sure.
Who's the closest visiting angels in that area, or Glendale, Tucson,
Sometimes
Flagstaff.
it's helpful to have the zip code.
Oh, absolutely.
Because we are broken down. So it's easier just to look up your zip code and give you that office than
you go.
see who's
Absolutely.
in Glendale and, so.
Try to figure it out.
Yep, just, or if it's for a loved one, if you're calling for mom and she lives in Mesa, but you don't know where, but
Sure.
just find her zip code. It'll make things so much easier and smoother for whoever's going to give us a call.
Yeah.
And if they're not in Arizona?
We
Once
have it
again,
nationwide.
just give us a call.
We have a
guide you.
directory.
And because we also
Okay.
take care of a lot of snowbirds.
Okay.
So,
Okay.
and that's the other thing. We can actually pick them up at the airport, bring them back, take them back to the airport.
Nice.
Personal assistant. So,
Awesome. All right. Well,
Absolutely.
share your number one more time just in case they didn't get it earlier.
480-833-8247.
Awesome. Thank you, Monica. Thank
You're
you,
welcome.
Melissa.
Thank you.
Thank you, everybody, for joining us for Community Connections, brought to you by Arizona Care Hospice. We look forward to you joining us for our next podcast session. Thank you.